To this conversation, now we continue with our series on the crisis of teenage pregnancy in the country. This year saw the number escalate from 90 back in 2024 to 130 this year. This is based on the final number of babies delivered on Christmas Day in public healthcare facilities. The National Health Department says a total of 1,666 babies were safely delivered on Christmas Day, compared to the 1,360 babies delivered during this time last year. Gauteng recording the highest number of newborns at 428 babies. What can be done to protect young girls from falling pregnant, we ask today, and is enough being done to advance sexual education? To talk about this, we're joined by the CEO of Save the Children South Africa, and that's Gugu Xaba, who joins us now on the program. Ms. Xaba, thank you so much for taking the time to chat to us, and festive greetings, and hope you are having a good one, but also nonetheless the important conversations continue. So let's talk about Save the Children South Africa and some of the work that you do in ensuring that we have young people, that stay away from all of the social ills that we see in our communities.
Good evening. And good evening to your listeners.
All right, let's talk about this problem that we're talking about today, and that is teenage pregnancy. And we're seeing the numbers soar year in and year out. The numbers continue to go up. Let's talk about how did we get here?
Baliswa, thank you very much for the question. It's difficult to say how did you get here, but it is possible to indicate that we saw it coming in the past years. And how we saw it coming is that we've seen growth of children that are below 18 years falling pregnant, and the numbers have been growing. And there are multiple reasons and factors that contribute to this. In many instances, you'll find that education is given, but it is ignored.
Yeah.
And in some instances, people do not know. For instance, when a girl starts menstruating, immediately you have a likelihood of falling pregnant. But now the child is still worried why they are menstruating. They don't understand that this is a time that says you are breaking out of being a child into a girl that is ready to accept a pregnancy. So it's lack of knowledge. But then we have also seen of late, as you just spoke to someone about the use of alcohol. Young people are using a lot of alcohol, and this kind of disturbs them. And when they are disturbed, it means they have a likelihood of having an intercourse that they may not remember or they may not have done if they were not intoxicated. And then we do have areas where, because of poverty, there is transactional sex, where people that are in need of groceries will sell their bodies simply because they need income for them to buy groceries. It is growing, and we've seen through the fact that then when people get to clinics and they're tested, they are pregnant, but they also have a sexually transmitted disease that they did not know about. And all those are saying some of the encounters are not planned. And that is the problem that we have. A lot of education is being provided, but at times we don't listen as much as we should, Baliso.
It's Mxolisi here. And of course, just to quickly, just to hammer on that point again, I think you are making such an important and critical point as we have this conversation, particularly around the dynamics that are usually at play. And I'm always concerned about our rural areas, particularly when we look at young girls, because that's where the greatest and biggest numbers are. When we look at your KwaZulu-Natals, when we look at your Eastern Capes, particularly with teenage pregnancies, the numbers there are alarming. Are we really hammering the message when it comes to those areas? But also, are we having honest conversations around teenage pregnancies?
Okay. Policy, thank you and sorry about that. We are having honest conversations. The one challenge that we see as Save the Children is that parents do not have sufficient information to be able to have the honest conversation, such that they end up avoiding the conversation. But then in school, we have life skills. And life skills consist of a module that is called Comprehensive Sexuality Education. It is provided in all schools. Again, the contribution we make as Save the Children is to teach the teachers that content so that they're able to be easy when they are presenting that topic. And then we also teach young people. We've got what we call youth clubs that we go to, where it's just young people, the conversations are honest to say, this is what is happening to your body, and this is what is likely to happen in case you are exposed to sexual intercourse. So the conversations are happening. They may not be happening with everyone and at the consistency that they should, because they need to be consistent almost every day in order for us to be able to deal with the problems that young people face. How do they say no when they should say no? And why do they say no? So that they can, understand the why and be able to leave the why.
And here's the sad part of it all. Actually, when we narrow it back to the communities that we're referring to now, the sad part is that sex talk in some households is still taboo. And I say this because I want us to now narrow it back to, some of your approaches as Save the Children South Africa in addressing unintended pregnancies, where you say you believe in holistic interventions that build empowerment and involve support from boys and men, and also strengthen opportunities for girls beyond early motherhood and dismantle barriers to services. Here's the thing, we need to have a society where everybody's having conversations at the same time, because these young girls are not having sex by themselves. How do we ensure that we have a nation that is empowered enough to be moving forward with these conversations?
Thank you for that question. Remember, when we go to schools and provide life skills education, it's provided to both boys and girls. The youth clubs I'm talking about consist of both boys and girls.
Yeah.
When we work with parents who are supposed to help their children to grow, those parents are having both a male child and a female child. So when you get to the clinics again, when we provide attention to sexuality needs, we're providing them to both male and female. And in that way, it's comprehensive because everybody gets the education, and we start as early as from 7 years old, even in early childhood development centers. You've got a book that says this is your body and this is how you treat your body and this is how you respond to anybody that touches your body or anything else. So a child is taught about their body from as early childhood development.
And also that means
so that makes it comprehensive.
Yeah, that also means that there is a need for access to all of these programs that you talk about, because it's one thing for them to be there and it's another for the communities to be able to enjoy the full benefits of those programs. Before I let you go, Ms. Xaba, perhaps talk to us about how people can reach out to Save the Children South Africa, particularly when we look at those communities that might be in need of some of your services.
Okay. Thank you very much for that. Save the Children South Africa is found on the website. It's savethechildren.org.za.
All right.
And then I think that's the best platform to find us.
Fantastic. I must thank you so much for taking the time to chat to us today. I wish we had more time to continue with this conversation, because we can never have enough of such important conversations. But thank you so much. In the meantime, that's CEO of Save the Children South Africa, Gugu Xaba, joining us there on the program. Thanks so much indeed for that.